Hi, I'm Debs Teasdale and thank you so much for accessing this second video on gentle exercises to keep you strong and mobile during your pregnancy, and especially if you're experiencing any form of pelvic girdle pain too. The first exercise I'd like to talk you through are your pelvic floor muscle exercises. Your pelvic floor muscles sit deep within the pelvis here. So these are your hip bones, your pubic bone is at the front, your coccyx bone is right at the back here, and then you have a hammock of muscles which sit deep in the pelvis. You have superficial ones and then you have the deeper ones. And during your pregnancy, these can become weak from pressure from baby's pushing down in on those muscles, but also from giving birth too. So it's really important we keep these muscles really strong to support your bladder, your bowel and your vagina at this time. The first exercise we encourage you to do are the slow exercises. This is where you imagine that you're stopping yourself breaking wind, you're stopping yourself having a wee, you're squeezing up and in, and you're seeing if you can hold that for up to 10 seconds. The second exercise is a fast squeeze. This is where you squeeze up and in as if you're stopping yourself breaking wind or stopping yourself having a wee, and then you relax it straight back down. And you try and do that 10 times. It's really good if you can try and do this 3 times a day. The second exercise I'd like to talk you through now is your tummy brace or your abdominal brace. I'm just going to turn around and sit on the side so you can actually see my tummy whilst I'm doing this. So if you pop your hands on your tummy nice and gently, and then have a nice little breath in, and then breathe out. And as you breathe out, you're gently going to engage those tummy muscles and relax. So you're imagining that your tummy is coming gently back towards your spine, and then relax it. You can do this exercise up to 10 times, 3 or 4 times a day. The next exercise I'm going to teach you is a pelvic tilt. I'm going to teach you initially in sitting. You can also do this exercise in 4-point kneeling, in side lying, in lying and in standing. So here it is in sitting initially. So what you're going to do is you're just going to gently slump back down and then sit back up, and you're mobilising that pelvis forwards and back. So you're flattening this part of your back and then you're sitting forwards. Pelvic tilt in crook lying. So tilt your pelvis up and flatten your back on the floor. Pelvic tilt in side lying. Tilt your pelvis forward and flatten your back. Pelvic tilt in 4-point kneeling. Please ensure your hands are underneath your shoulders and your knees are underneath your hips. And you're going to arch your back up, tuck your bottom in, and then stick your bottom out. Arch up and arch back down. Pelvic tilt in standing against a wall. Ensure you have soft knees and then you tilt your pelvis as if you're massaging your back on the wall. The gym ball is a great piece of equipment to use during your pregnancy, and especially if you've got pelvic girdle pain. It spreads the weight of your pelvis as you're sitting on the ball, and it's really comfortable. It's actually helping you to engage your tummy muscles by just sitting on the ball, and it's also encouraging a really, really good posture. If you are looking to buy one, please ensure that your knees are lower than your hips. I am 5'5" tall, and this ball is a size 65, so that may give you some idea if you're looking to buy one. So what can you do on this gym ball? Well, you can do some gentle pelvic tilting on the ball, which is really gentle and helps you keep that pelvis really mobile. You can also do some gentle circles, going left round to right and right round to left. You can also do some just gentle side-to-side movements as well. Thank you for watching this second video on gentle exercises during your pregnancy for pelvic girdle pain.